Welcome to Caregiver SOS On Air, presented by the WellMed Charitable Foundation, with nationally known gerontologist Carol Zernial and award-winning veteran broadcaster Ron Aaron. This program provides health, wellness, and other information for caregivers who are vital to the health and well-being of so many people across our country. And now, here are your hosts, Ron Aaron and Carol Zernial.
Well, hello, everybody, and welcome to the award-winning Caregiver SOS On Air. I'm Ron Aaron, delighted to be with you today, and our co-host Carol Zernial is here. Carol holds a master's degree in social gerontology, some 30 years' experience in the field. She's co-chair of the Raise Family Caregiving Advisory Council and executive director of the WellMed Charitable Foundation. And Carol, it is great to be with you again.
Well, it's nice to see you, Ron.
I can remember talking several years ago about how some of your grant writers were concerned about all the things that caregivers were doing that looked like medical care, and it was of great concern at some point. It turns out to be a reality, does it not?
Well, it does. In fact, that was AARP, and they released a report about all of the nursing tasks caregivers perform, and it's quite a large variety. It is things that maybe even 15 years ago a nurse would do, or even a physician would do. And now people are, they leave the hospital, they go home, and caregivers are asked to do some pretty serious work. And wound care, has to be done well. You don't want any of the wounds to go the wrong direction, because it's really hard to recover. And so I'm thrilled to have the topic of wound care today.
Well, we're being joined by Allyson Larkin. Dr. Larkin has been with us before. She does a great job. She grew up in Corpus Christi, received her BA Magna cum laude in Zoology from Iowa State University. That's got to be a separate show. She earned her medical honors from Texas A&M University College of Medicine. She's board certified in family medicine and Undersea and Hyperbaric medicine, and is a certified wound specialist physician. In her spare time, Dr. Larkin enjoys reading, writing, eating, hiking, and hanging out on the couch with her husband, children, and dog. So, Dr. Larkin, it's great to have you on again.
Thank you so much for inviting me back. I appreciate it.
Well, take 20 seconds and tell us, why zoology?
Why zoology? I like animals, and I thought I might be a zookeeper. And then I got close to graduating with my zoology degree and realized you needed to be a vet, really. So it was, but I like science. I've always liked science. I like how bodies and systems work together, and I just find it amazing. And so it was a good marriage of a love for science and a love for sort of like human and animal life and how our bodies work. And
speaking of human life, you've gotten heavily steeped in wound care, which unless you've had a wound, you don't realize it's a specialty. Yeah, it is. It's been a specialty really since the early 2000s, primarily as our population has aged, as we are all aging. It's becoming a more important specialty, and we've realized that sometimes intervening early and aggressively can heal wounds more quickly so that they don't become problematic or infected or chronic. And when you say wound, people are listening and they're wondering, what's the definition? Is it a simple cut on my arm? Is it more? A wound is any break in the skin, okay? Some wounds are more significant than others, obviously, right? Probably most people are most familiar with abrasions, right? Because life is real, and we trip and we fall and we brush up against things. And these are just very superficial breaks in the skin itself. And generally speaking, can be cared for very easily at home if you know what you're all about. Would you like me to tell you the way to take care of that abrasion at home if you get one, Ron? That would be great. Okay. We all end up with abrasion. Because we're gonna, right? If we don't do it today, we'll have it tomorrow or the next day, right? Or yeah, Carol?
So Dr. Larkin, before you tell us, I will tell you that as a child, everyone slathered mercurochrome, if you remember that. I don't even think they allow it to be sold anymore, which was this horrible red staining medicine. And all the mothers in the neighborhood, it didn't matter who you really belonged to, they would cover you in mercurochrome if you had a wound.
Yes. Well, so in the old days, let me tell you what I was told to do when I had an abrasion. We would douse it in peroxide, and then we would cover it in monkey blood. That's what we called it, which I'm pretty sure is mercurochrome or something, some sort of iodine type thing. And the intention is good because we're trying to prevent infection, right? We're all worried about infection, but ironically, the problem with that is that while killing the bacteria, we're also killing all our healing cells. And so we have really good data ever since the 1970s, actually, that we need to treat our wounds very gently. Otherwise, we're actually going to delay their healing. And so even though most of us, our parents told us to do all those things and maybe to leave it open to air and scab, right? That's the other one. We know now that wounds that are kept just a little bit moist will heal more effectively. And they'll also be, if they're covered, they're going to be less likely to get an infection. And
hold that thought. I'm going to come right back to you. I want to let folks know who may have just joined us. You're listening to the award-winning Caregiver SOS on air, our program available on podcast in whatever way you get your podcasts. We're also on the radio in several markets in Texas and Florida as well. We're talking about home care for caregivers and ways they can make life better. We're talking with Dr. Allyson Larkin, a doctor specialist in wound care, and Carol Zernial, our co-host, is here. I'm Ron Aaron. So let's get to the wound, Allyson. You mentioned something that's really important, and that is my grandma and my mom always said, don't cover it. Let the air heal it. And what I heard you say is, yes, cover it.
Yes, cover it. Yes. So the way we heal, the way we fix that defect in our skin integrity, right? Our skin armor, is that the healing cells, they migrate from the edges of the wound or they grow up from the bottom of the wound. And to do that, they're migrating in on these little tiny microtubules. And what I actually think of it is it's like they're ice skating in. And so if you have a nice moist wound surface, they can migrate in much more quickly. But if you have a dry wound surface, I tell people it's like trudging across the Sahara. They have to work so hard, they're getting tired. Those healing cells can't work as efficiently as they want to heal you as quickly as they want to. On the other hand, if you are soaking wet, okay? Because we worry about our wounds being too wet, right? So it is kind of like Goldilocks. We want the wound not too moist, not too dry. So in most cases of a superficial wound, just a simple non-adherent bandage over the surface is going to keep the wound surface sort of glistening moist without being soaping wet, right? Like we don't want to look like when we take off the bandage that the patient's been sitting in a bathtub, right? So if the skin around the outside of the wound is white and wrinkled, like the patient has been sitting in the bathtub, then that wound is too wet, okay? But that doesn't mean we don't cover it. What it means is we need to change that dressing more frequently, and we might need to be detectives and try to figure out why it's wet underneath that dressing. If the dressing is getting wet in the shower, or if the dressing is just collecting because of sweat, or it's just big and it just needs a bulkier dressing. So generally speaking, though, just so we're clear, wounds that are covered will heal more quickly and be less likely to get infected. And so what we want is a moist but not sopping wet wound bed to maximize our healing velocity, to heal as fast as we possibly can, which is everybody's goal.
What about using Aquifer to moisten that wound bed?
So that can be a very good choice. And so Aquaphor or Vaseline, particularly on something like a superficial abrasion, where we're talking about like those abrasions when you rub up against something, is a really good choice because it's keeping that wound bed just a little bit moist.
And the question of, isn't scabbing good? My mom always said, you want to grow a really good scab there, Ron.
Again, right? But the problem is the healing cells, they're trying to close that wound, and they're hitting up against the side of that scab, and they're not able to close that wound as efficiently. Eventually, they'll work really hard and they'll crawl underneath that scab and they'll separate that scab off. But you're creating more work. You're creating more work for those healing cells. And I say, let's just give them a break. Let's just make it easy. So it's against what we all learned, but there's very good data, and I feel very confident in telling you that that's not what we want to go for, generally speaking.
Well, aren't scabs body's natural mechanism to cover a wound?
Yeah. And so scabs, to a certain extent, right? Scabs a lot of times are a little plug, a platelet plug, which stops the bleeding, right? And it is the body's natural cover. And so if you're putting a Band-Aid on it, it's eventually going to separate off pretty quick. But if you're putting peroxide on it or alcohol on it and you're leaving it open to air, you're continually like sort of redrying it out and making it harder for that scab to fall off. And so maybe the cavemen, were forming their scab, but they weren't also using peroxide and alcohol on top of it. So again, will you eventually heal underneath the scab? Yeah, you will. But if you want to heal fast, you want to try to prevent that scab from forming.
So Ron, I'm going to tell you that there's natural blonde and there's even looks better blonde with a little bit of help.
There you go. Let's give our bodies a hand.
Yeah, why not? And look better, feel better. So a lot of us that have been in the care business over the years know wounds as being bed sores. Someone who is stationary too long in one place. So when we say a bed sore, what are we really talking about?
So bed sores are technically sores that are caused by pressure on the skin between the surface of the bed and the bone underneath it. So basically the skin and the tissue, the muscle underneath the skin are getting compressed and pushed between the bone and the bed or the wheelchair surface or whatever else. And so we call these pressure sores. They're sores that are caused from pressure. In the old days, there was the term decubitus ulcer was one, bed sore was one, but at the end of the day, it's pressure injury that occurs between the skin and the support surface. And so it's a really common problem, right? As we're sitting here, we don't even realize it, but we're shifting our weight constantly. Just subconsciously, every 15 or 20 seconds, I'm shifting from sort of one hip to the other hip. And we see bed sores, especially commonly as patients get older and they're maybe not able to shift their weight in the way that they're supposed to, okay? Maybe they've broken a hip and their hip hurts and they're not moving that leg, and they might be prone to get like a pressure sore underneath the heel, the bed sore, the pressure sore underneath the heel, or maybe they're laying in bed a lot, right? They're not able to get up and get out of bed like they normally would. And maybe they're not able to flip from the left side to the right side to the back like they would. All of those things lead to longer periods of pressure than what our bodies are meant to have and make people more likely to get pressure injury and ultimately a pressure sore or a bed sore.
All right, we're going to come right back to you. Hold that thought.
Okay.
What I heard is good. My flopping around in bed is a good thing. You're listening to the award-winning Docs Caregiver SOS on air. I'm Ron Aaron, along with our co-host Carol Zernial, and our special guest is Allyson Larkin. Dr. Larkin is very knowledgeable about wounds and wound care and a whole lot more. You're listening to Caregiver SOS on air. Well, thank you so much for listening to Caregiver SOS on air. We're delighted to have you with us. We come to you every week with a discussion of an issue, a problem, some accomplishments involved in caregiving with more than 60 million caregivers across this country, but most thinking they are the Lone Rangers. We try to bring you the latest information and help that can make that job easier and more manageable. Caregiver SOS on air takes a look at trends across this country. We provide tips on how to be a better caregiver and, most importantly, where you can go for help. On Caregiver SOS on air, we try to give you what you need to make that caregiving manageable and to provide you with the help that can make your life easier. I'm Ron Aaron. Carol Zernial and I are delighted to co-host this program, and we're thrilled you've joined us on the award-winning Caregiver SOS on Air podcast, available everywhere, brought to you by WellMed Charitable Foundation.
Hello, friend. Hello, friend. Really good to see you once again. Hello, friend. Hello, friend. Really good to see you once again.
Well, we are so pleased you are sticking with us right here on the award-winning Caregiver SOS on air. I'm Ron Aaron, along with our very special guest, Dr. Allyson Larkin, and Carol Zernial. Our co-host is here. We've been talking about wounds and wound care and how they happen. And right before we did a little business at our end. We were talking about pressure sores and lying in bed, and I had said that, Allyson, my flopping around in bed is a good thing.
It is for you. It might not be for your bed partner.
It is not for the sleep. That is correct.
Yeah,
Right.
but so we know that anyone that's not able to shift their weight because they're not strong enough or because they don't feel that they need to shift their weight are going to be at risk for pressure injury because they're not relieving the pressure so that the skin and the tissue can bounce back. We also know that people that maybe are malnourished, that aren't eating as well as they need to be doing, and they might have low protein and albumin levels. We see that people that have been sick in the hospital, sometimes people with dementia who just don't have the appetite that they used to, people that have other serious illnesses also just don't have as a robust skin barrier, and they can be a little bit more likely to get a pressure sore. So maybe, a 25-year-old athlete can lay on that heel, for 6 hours. But if you've got a frail, elderly person who might be malnourished, who might have low oxygen levels, they're actually more likely to get pressure injury, pressure sores much more quickly. And so specifically in that population, in the elderly population, we want to always be checking their bony prominences for signs of pressure injury, which could be some redness that's persistent, that doesn't go away. That would be a very early sign, and that's where we want to catch it and intervene. It could be a sign of a bruise, we call it a bone bruise, right? But a bruise over a bony prominence. It could be a sign of even just a superficial wound. But if we're seeing any of those problems over, say, the back of a heel or the side of a hip or the middle of the bottom or the sitting bones, we want to take that really seriously. And the most important thing to do at that point is to relieve the pressure, is to reposition the person and try to keep the pressure off that area as much as possible. And then you want to reach out to your provider as soon as possible and let them know what's going on, so they can sometimes help you to get some support surfaces that can help to distribute the pressure a little bit more effectively. Sometimes we'll have people to float their calves on pillows so that those heels aren't driving into the bottom of the bed, right? Sometimes we'll have people to spend a little bit less time in a wheelchair for a short period of time if that's an issue. Sometimes we can use wedges and pillows in bed so we can get creative about different positions. But pressure injury, it's much easier to prevent if we can identify it than to heal a pressure sore later. Yes, ma'am.
And I just want to underscore what you said about all the different ways, devices that we can prevent a pressure sore, because those didn't always exist or they weren't easy to get to. A lot of the things you talked about are covered from your health plan, from Medicare. You can get those additional tools covered through your health plan so that you don't have to purchase them. And they make a huge difference. I mean, we have known people that were fighting a pressure sore that got out of control literally for years.
Yeah.
Do they get infected? Is that part of the issue?
And they can get infected. Yeah. I mean, the goal is that they don't, but they do. The longer you have an open wound, the higher the risk that they can get infected, because all of us have bacteria living on our skin. That's the nature of being a human being. And so if you have a break in that barrier, a pressure sore or any other wound, you do run the risk of infection, which might actually be a good time to talk about signs of infection. What do you guys think? Because that's what we worry about, right? When we're dealing with a small wound or a big wound. That's why our parents, were peroxiding us 10 times a day and using mercurochrome and, all those other things, is because we're worried about infection, because we know we want to try to prevent that. And so I'm first going to say that most wounds are not infected, okay? And so just because you have a wound does not mean you need an antibiotic. I will also say that a wound culture, which is something that some of you may be familiar with, which is where you swab the top of the wound to see if any bacteria grow, does not tell you whether a wound is infected either, because all wounds, because they're sort of on the surface, they're going to probably grow bacteria. And so just swabbing a wound and getting something to grow doesn't mean the wound is infected. A wound is infected when you have enough bacteria living on the surface that they're causing harm to the wound, that they're causing the individual to have to, their body to have to work hard to fight the wound, okay? And so What we'll see if a wound is infected a lot of times is that we might notice some increased pain. Okay. That can be a very important sign that we want to pay attention to, particularly if it's like a diabetic who got the wound because they didn't have good feeling. If they start having pain in a wound, that might be concerning. Okay. Also, increased redness or warmth, heat around the outside of the wound, that can be a sign of infection as well. Now, normally, after we get a wound, our body sort of works to take care of it. And there could be a little bit of redness immediately after the wound forms in the first day or two. But if you have a wound that's been present for a week and it's been rocking and rolling, and all of a sudden you notice like, oh, it's red around that, or oh, it's tender, or it's a little bit swollen, those could be early signs of infection as well. I would say increased drainage or increased odor in a wound could be signs of infection. Also, if you're diabetic and you've been rocking along with your blood sugars and all of a sudden your blood sugars are out of control, that could be a kind of an unexpected sign of infection. And then also, if you have an open wound and you've been rocking along and all of a sudden you feel sick, you're like, God, I feel sick. My body is achy. I feel like I've, got an infection, but I don't have a cough and I don't have an earache and all those other things. That could be a sign of a wound infection as well. And then obviously fevers or chills, those would be signs of a problem. And so while I always encourage people, not every wound needs an antibiotic. We want to just be thinking about the possibility of infection. And if you're concerned, the best thing to do is to reach out to your health provider and they can help you to make that decision.
And when should that provider refer you to a wound specialist like you?
Okay. So generally speaking, a wound specialist is an appropriate referral for a chronic wound. Okay. And a chronic wound is one that's just not healing as would be expected, right? Because we can't put a time on it, because like a superficial wound should heal in 2 to 4 weeks, right? Whereas a deep pressure ulcer, it might be doing well, but it still might take 3 months. So any wound that a provider thinks is not healing as expected, but I would say almost every wound should be at least half better in a month. So that's I'm just going to throw that out there. So half better in a month, doing a reasonable job. But then also any wound in someone that might be expected to have trouble healing, those would be people that might have poor circulation, either because of peripheral arterial disease. A wound on the foot of a person with peripheral arterial disease, it should be referred probably to a specialist, because we know they're higher risk for non-healing. Patients that have a lot of swelling in the lower legs, or what we call lymphedema in the lower legs, that causes poor circulation as well. And those would be wounds that should be referred. Wounds in patients who are diabetic, and particularly poorly controlled diabetics, those are wounds that should be referred, because we know that poorly controlled diabetics don't fight infection very well and they're more prone to getting infection. Wounds in patients who take immunosuppressant medications. We have a lot of patients now that are living long times with cancer and autoimmune disease and other very serious health problems, which thank God for the medications, right? Because they're helping people to live better lives. But some of those medications can make people more likely to get infection and also make healing slower. So any chronic wound, which is a wound not healing well, probably not at least half better in a month, or any wound in a patient who can be anticipated to heal poorly, would be a very appropriate wound care referral.
That's a lot, Carol, for a caregiver to know.
Well, it is. It is. And so, on a worst case scenario, why are we preventing that infection? What happens if we don't treat that infection?
If you don't treat the infection, worst case scenario, starting at sort of baseline is the wound will worsen and the person will suffer from maybe increased pain. It can lead to sort of worsening of other chronic health illnesses. We know that, say, somebody with dementia who gets an infected wound or any sort of infection, sometimes their baseline mental status can get worse. If a wound gets bad enough on a foot or a leg, it can lead to amputation. If a wound gets deep enough and it gets into the blood, it can cause something called sepsis, which unfortunately can be fatal, can kill you. Yeah, it causes your blood pressure. Your body trying to fight that infection can cause your blood pressure to fall, and you can have heart attacks and strokes and suffer from kidney failure.
We are flat out of time.
Ah,
But that's fascinating. I feel like I ought to get a certificate now for a course in wound care. I want to thank you very much, Dr. Allyson Larkin, and our co-host, Carol Zernial. If you have any questions about wound and wound care, see your PCP, and if they can't do it, they'll send you to a specialist like Allyson who can help you. I'm Ron Aaron. Thank you so much for listening and joining us today on the award-winning Caregiver SOS On Air. The executive producer for Caregiver SOS On Air is Daniel Calderon. The producer is Sharice Pendleton, and the associate producer is Catherine Oglesby. We'll see you next week on Caregiver SOS On Air.
You've been listening to Caregiver SOS On Air, an exclusive presentation of the WellMed Charitable Foundation. We welcome emails with suggestions and comments on this program at radio@wellmed.net. Join co-hosts Carol Zernial and Ron Aaron next week for more on caregiving, improving the health and well-being of caregivers and their care recipients everywhere. For more on caregiving and podcasts of our programs, visit caregiversos.org.